All across Montana, people are making a difference.
Hank was assigned to my classroom as a 4th grade student. He stayed in the classroom as a 5th grader when I transitioned up, so I did have him 2 years.
My name is Hank Edward Sikowski Palin, and I live in Missoula, Montana, and I go to C.S. Porter now, and I'm in 7th grade.
I didn't know very much at all about diabetes 1. Before school started, we had a meeting with the nurse and Hank's mom and myself and our school psychologist, and went through some of the protocols, the things I needed to know about Hank, things I needed to be aware of, set up a training schedule for me.
Type 1 diabetes is where your pancreas does not work at all, and you have to produce insulin yourself by either wearing an insulin pump or injections, and it's most common in younger kids like me.
For me, Hank's mom was the expert, and I needed to learn to call her and talk to her and trust her and have her trust me that I was paying attention. We had a private place that he could just step out and check anything and the kids wouldn't be around. And the supplies he needed we kept in my closet here also, so that he could just reach in and get what he needed. He had a case that he carried with him if he went to another classroom. He was always to have that with him, so we made sure that he was always prepared if he needed it. The reality is that we're lucky enough to have a nurse that's on call. We don't have a nurse in our building, but she is on call and can come and contact us anytime. We know that's not the case everywhere, and so the team can be trained and the team can handle the student and help the student up, but the team has to be trained completely, and there are ways to do that, and so that you can deal with a kid as you need to, and then contact nurses later on for more information you might need on a non-emergency basis. But the team can do it. The team can be trained to help out with that student. Learning how to do the glucagon shot was important, but it was the last-ditch thing that you would ever need to do if the child was unresponsive. It's just real life. They're there, so they need to be treated like what they are. It should not handicap them in any way. They should just be going ahead living their life.
Well, for a sport, I do track and field, and it's really fun, and diabetes has never stopped me from doing anything I like. And if I feel low, I just take a 15-minute break and have a juice and check my blood sugar.
Other teachers who maybe didn't have the connection with mom would say, oh, you know, aren't you afraid to let him do something like that? Or should Hank be going on that field trip? Of course. But we all have it worked out. You can't sit in a box. Hank had been going to school with these kids for 5 years, and so they knew him.
They've all been kind of curious about it, and I've just let them watch me check, and they said that's pretty cool.
The challenge for me was not being able to get up in the morning and say, I'll go grab the kids some cookies for school today, because I always had to think about what will work for Hank, what will be the timing for Hank. Also, there was another person I always had to, let mom know, or if we had a field trip, the nurse and I had a contact about that quite a ways ahead of time so she could get it into her schedule so she could attend at lunch to help make sure that everything was fine. So those are things I had to think about that I never had to before. Also, it was a real education for me that I had no idea the amount of carbs in certain foods and the effect that it would have on him if we didn't put it in the pump. Ran into some challenges sometimes when the pump quit working, or they would not have enough materials, and then the nurse would have to be here pretty much all day. The big sign that I looked for with Hank is if he looked tired, if he put his head on the desk, if he needed to start using the bathroom, if he needed to make sure that water was going, which we were very aware of anyway, but was the head on the desk. And if he looked tired, then I would have him check.
Yeah, if I'm low, I usually just get shaky or kind of tired, and I don't really feel active or anything. So that's how I know if I'm low. Then if I'm high, I just feel really dizzy, and I have to go to the bathroom a lot, and I have to drink lots of water.
I think I kind of got into Hank's rhythm a little bit in terms of understanding what he would and would not do as a 5th grade boy, and that he was very good at telling me if he wasn't feeling well, so I learned to trust that. The advice I would give to another teacher is make sure you rely on the nurse and rely on the child's team. You don't have to do it all, but you should be the central person that knows where he is and what he's doing all the time. Depending on the age of the kid, you need to interact with them a lot and trust them and say, how are you feeling? And also be present when they check, and if they have a pump, put the number in, because they might accidentally reverse those numbers. He had been taught that over the years, to assume that responsibility, and so did I learned it, and so did the kids in the room. This is what we do. This is how we eat. This is how we are friends. And so what if Hank has diabetes? It's no big deal. Nobody reflected on it.
She's on top of it, and she's always been there for me, and yeah, she's really nice.
Brought to you by the Montana Department of Public Health and Human Services. Another way we're keeping Montana healthy.